Na ina mpesa wo de jeme pa my prayer my power na yemko. My prayer my power.
Courage in the Lord. Do not look at that situation. Do not look at that problem. Do not look at that dry land.
Asking someone, asking for something. Looking for a party. Thank you.
TV, impacting through the gospel.
Na ina mpesa wo de jeme pa my prayer my power na yemko. My prayer my power.
Courage in the Lord. Do not look at that situation. Do not look at that problem. Do not look at that dry land.
Asking someone, asking for something. Looking for a party. Thank you.
This program is proudly sponsored by Benbeni Travel and Consult. For your passport, visa, and other genuine traveling documentation, locate Benbeni Travel and Consult at Osuforiko Mall. Contact Benbeni on 0244 362 445. Are you looking for the best engineering company for any kind of automation works like roofing and block making machines, construction and batching plants, and many more? Then Freop Automation is your best option. Locate us at Amasaman at Jen Kotoku. Call Freop Automation Limited on 050-493-9395. For all your Casapreco products, drinks, and water, find Emco Enterprise at Tema Community 2 near Wasaman Chop Bar and Dowenya. Reach out to Emco Enterprise on 0244-324-883 for all your media works, video coverage, media setup, graphics, sound, and many more. Contact Lightest Multimedia on 054-817-9863. Are you in need of logistical services like import and export, freight management, and many more? Then contact Priest Logistics on 0246-658-161 or 0244-777-276. Priest Logistics is located at Captain House, Tema Community 5, Room 3, behind Hanch Catering Services. Kenley Company buys and sells used and new office chairs, kitchen set, drawers, and many more. Locate Kenley Company opposite Tema Stadium at Tema Community 1, opposite Tema Stadium, or call 0244-219-633 or 054-514-7679. Reps Household Limited. We provide cash and credit sale of all gadgets like TV sets, rice cooker, home theater, and all kind of gadgets. Contact Reps Household on 0243-817-535 or 054-609-0403. For all your kids and unisex African wears and etc. Contact eFashion and Boutique on 0244-084-240 or 0245-791-365. Locate eFashion off the Tema Community 1 Road, adjacent the police station. eFashion, home of African designs. Decovas Enterprise provides services like wedding decor, wrapping, funeral decor, floral arrangements, and many more. Locate Decovas Enterprise at Tema Community 2, opposite the post office. Contact 0244-260080 or 0243-602-2021. Decovas Enterprise. Say it all with flowers. For all occasions you require beauty services like hair washing, makeup training, wig making, hair braiding, manicure, pedicure, and many more. Reach out to Crash Makeovers Beauty Parlor off the Mataheko Afienya Road. You can contact Crash Makeovers Beauty Parlor on 0548-247-845 or 053-598-9444. Crash Makeovers Beauty Parlor. Beauty beyond imagination. Do you have a dream of helping the kingdom business and sending salvation to the doorsteps of people? Abba Partners is here for you. Join Abba Partners now and together win souls for Christ. Call 0243-804-676 to be a partner now. Join Promised Land Faith Ministries International every Monday, 7 p.m. to 8 p.m. for Bible study. Log on to Promised Land Faith Ministries International on Facebook to join for a divine prophetic encounter. Join our Faith Hour service every Wednesday, 9 a.m. to 2 p.m. and on Friday, Manifestation Half Night, 7 p.m. Promised Land Faith Ministries International holds 2 services on Sunday, 8 a.m. to 12 noon at Faith Temple, Tema Community 1 and 6:30 p.m. at Atadeka Branch, 40 Rooms, Coco Junction. Remember that we bring you a 3-day power-packed conference every last weekend of the month. Friday, Dominion all night at 9 p.m. Saturday, prayer and deliverance session. Sunday, victory service. He is God. He can do all things.
Hello, wonderful people. This is Health Talk on PCTV, and you are so welcome to another episode. It's a blessing to be here, and I must say I've really missed you, and I know you've also missed me as well. It's good to be finally back in the studios, healthy and living good. Okay, so this is Health Talk, and today we're going to have another interesting discussion on a topic that I think most of us overlook it, or we probably may have been trivializing it. Today we're going to look at first aid at home, and we're going to focus on bleeding and then seizures. Maybe bleeding, you would think, okay, maybe for a minor cut, I'll just apply an ointment to it, alcohol to it. Some people even put perfume on it, and they think they are good to go. So today we're privileged to have a professional nurse in our midst, and she is going to help us understand bleeding, the different types of bleeding, and how to manage it and manage it effectively. And if you have to visit the clinic for some stitches or whatever that you need, then you would go in for that. So don't go anywhere. Please stay right with me, and I would like you to kindly invite friends and family to join us on today's discussion. Okay, so for those of us joining this show for the very first time, this is Health Talk on PCTV, and PCTV is Promise City TV. It's a Christian channel, a part of a bigger ministry, which is Promise Land Faith Ministries, and it has the overseer and then the founder in the person of Apostle Mrs. Bernice Ajiman Prempe. There's no way we can be on this show without acknowledging her. Thank you, Mami, so much, especially for giving me this opportunity to host Health Talk on this channel. It's been a great time here on the show, and I don't take it for granted at all. Thank you so much. And another special thanks to the husband of the apostle, Mr. Benjamin Ajiman Prempe. Thank you to Papa for the support throughout these years. PCTV is 1 year, and we are still counting into more glorious years. And we're hoping to see a bigger and a better channel that is geared towards improving our lifestyle, a wholesome lifestyle, not just our spiritual growth, but as we have a health talk concerning our health and well-being as well. And so we are so grateful to both of you for having this program and the many other programs held on PCTV and the support. Okay, so let me just talk a little bit about Promise Land Faith Ministries, so that if in case you happen to be in the neighborhood, you are always welcome to join us fellowship. So let me start with PCTV on the channel. So on the channel, every Monday at 7 p.m. we have online Bible studies. Then from Monday through to Friday, we have Visitation Hour, which is hosted by our mother, Apostle Mrs. Bernice Ajiman Prempe. Then on Wednesdays in the evening at 7 p.m. is Exaltation Hour. Thursdays at 3 p.m. is Inspirational Hour by Pastor Jessica. And then on Sundays, as you have me here, hosting Health Talk. And so you're welcome to join us at any time, as I've mentioned earlier, on PCTV. Then in person at any of our temples. So we have 3 temples of fellowship. We have the Faith Temple, which is located at Tema Community 1, behind the Goil Filling Station. Then we have Victory Temple, which is located at Ashiama, Atadika. Then Dominion Temple is at Dojum, Doyum, that's off the Shire Hills Akosombo Road. And the times of fellowship is on Wednesdays 10 a.m. at the Faith Temple, Temakomti 1. Then Sundays in the morning at 9 a.m. still at the Faith Temple, Temakomti 1. In the evening at 6 p.m. you find us at the Victory Temple at Ashiama Atadeka. Then on the last Friday of every month, the weekend, Friday, Saturday, Sunday, you would find us fellowshipping or worshiping at the Dominion Temple at Dojum. And so you can join us anytime there. Okay, so back to our discussion for tonight. As I mentioned earlier, we're looking at first aid at home. First aid at home. And we're focusing on bleeding and seizures. And we are privileged to have a nurse with us in the studio. And before I introduce her, I hope you're inviting friends and family to join us on the call. And I'll also love to hear from you. So as we do here, you can type in the comments, "He is God," and we'll respond, "He can do all things," and acknowledge your presence with us. So I wouldn't waste my time. Our nurse is ready to give us all the apport that you need, what you need to know. Relevant knowledge. It's not just about knowledge. You need the right knowledge, how to handle any incident or emergencies at home should it come up. We pray nothing bad happens to us, but then it can come up. So when it comes, what do you do? How do you handle ourselves? And we have the right person with us in the studios to do that. So let's welcome Miss Elizabeth Butchie.
Thank you so much. It's been a while.
A long while.
And I miss you.
Same here.
Looking awesome.
Thank you. Looking good too.
Thank you.
Yeah. I mean, I think we scheduled and something
we keep
came up.
rescheduling. We keep
rescheduling,
yeah.
but finally
we are here
today. And I'm so happy to have you in the studio.
Thank you.
Before I do that, please let me acknowledge my co-host Debbie. She hosted the show for me whilst I was away, not too well. Thank you, Debbie, so much. You did a good job. And so from time to time you would be seeing her. Not that I wouldn't be well. I'll be well. I'm well.
I think so.
From time to time you'll be seeing her. So it's good to have you.
Thank you
back.
so much. Thank you.
So today, bleeding and seizures, first aid at home. Bleeding could be as a result of a whole lot of things.
Oh, yes.
And today we are limiting it to just the home.
Yeah.
Mostly women, you find the women, girls cooking, cutting, chopping
know.
stuff. Before you realize you have a cat.
That's true.
And sometimes with the kids running at home, they step on sharp objects or stuff, fall down, they have a bruise, and they are bleeding. So in these instances, what should someone do? Should something like this happen?
Okay, so today I actually like the combination seizure and then bleeding, because as I explained, you understand why I'm saying that, because it looks like it goes hand in hand.
Oh, okay.
So first we're actually looking
We're
for bleeding. Okay.
Yeah.
So bleeding occurs almost all the time. Our home, our offices, wherever we find ourselves. But how we manage it is the problem. So when we talk about bleeding, let's watch this video. This first video, then I'll explain. You see there's a cut. So that is bleeding. Bleeding is actually when there is a release of blood from any damage or cut blood vessels. You know that our body is made up of a lot of vessels. We have the arteries, we have the veins, we have the capillaries, and all these veins, blood runs through them. Yes.
Okay.
So anytime there is a break, there will be a release of blood. So obviously that is bleeding. Now what brings about this bleeding? I mean, you just can't be there and then you start bleeding. Something needs to happen. Exactly. Yeah. So let's look at a few causes of bleeding. So one is I mean, if you look at the one cutting, I mean, this another type. You can step on this and then a blood vessel can be damaged and of course you bleed. There's another type to that. Just look at this. How will you know if you have a knife in there or any sharp object? So you try to wash these things, then you end up cutting yourself, and then you bleed. And then you could also have this.
That was an awesome drum solo.
I mean, herself with a knife, or she can cut herself with a knife. All these are kind of causes of bleeding. Some can happen to a fall. You can fall and then you bleed. We'll get to the time. Some bleeding you can see, some you can see. Yes. So when there is a damage in the blood vessel as a result of these causes, I mean, you can end up bleeding. So I think that is
okay. So you mentioned it's types.
Yeah, we have the type. Okay.
Walk us through the types of bleeding, because all we know is
a child. So when you look at the blood vessels, like I mentioned, we have a lot, not too much. We have arteries, we have veins, we have capillaries. Capillaries help in the exchange of gases. The veins too, they also carry, deoxygenated blood. Yes, to the heart. Arteries carries oxygenated blood away from the heart to our body. And our body, of course, we need, the cells needs, oxygen to, function well. Yeah, and you can find this oxygen in the blood. So if you are losing this blood, how will the brain, your vital organs get these oxygens to function? So you get it. So these are the types. Now, when you look at the arteries, when you have a damage or a cut in the arteries, mostly the blood look a bit brighter. It's kind of a bright red, and that one, the blood comes out in a form of like a force. It gushes out. So it's not like the veins one that it moves steadily. We need to blood, and managing it is a quite difficult, but the management is still, we'll get there. Now when you look at the vein, we almost see the venous damage all the time. You see the blood moves steadily. It flows, just like the water flow. It doesn't spat. It doesn't come with a force. A movie, yes. So that one is a bit darker, like dark red. That is the vein. But the capillaries, that one happens almost all the time. The vessels are very tiny beneath our skin, so we don't really pay attention. For example, you see that bruises. You see that the blood oozes out, and why and flow and toe. But oozes out, and we have a way of managing that one too. So these are the types of bleeding. We also have a major one that we are not really focusing on that now, but I need to mention that we have internal bleeding, where the damage can occur inside and you bleed inside, and it's dangerous. I mean,
because you're not seeing
it,
so
and
think you're okay.
Imagine you are losing blood, your BBs will drop, you feel dizzy, a whole lot of things will happen, and you take it like a normal thing. I mean, if I'm feeling dizzy, let me just go and sleep. But you've had a fall that you're not complaining about. That is why in life you don't take chances. I mean, you need to report anything that happened to you. If you swab a bottom and you're keeping it to yourself, how will you know if you are bleeding inside? So internal bleeding is another form of bleeding, and that one is more dangerous, trust me. Yeah, so these are the types of bleeding. Yeah.
The when it comes to the internal bleeding, as you mentioned, is it only or mainly as a result of falling?
No, it can be trauma. Somebody can hit you with something, can be a blow, a whole lot of things can happen here. Somebody can hit your tummy, and then who knows? And we bet me a ball bet me if you swap a bottom and all that. A whole lot of would bet me a from car accident, So all these things can damage the blood vessels in there, and you bleed. Yeah.
Yeah. So in case you find yourself in such scenarios at any point in time in the home or outside the home, you have to report it.
Of course.
Because there's no blood oozing
out. But you knew you fall. Yes. You have to report it.
It's safer to go have yourself checked than sit and assume you are okay. All right. Okay. All right, so I think you've explained the bleeding, we've talked about the types, we've also talked about the causes.
Yeah.
So then how do we manage, that is the issue at home. I mean, way back, I remember we used to have first aid boxes in the home, and you would find some paracetamol, there's this Trasley kit. I knew that I used to have tummy ache, so that one, I know that. You would have gauze in there, and then spirits. What else do we usually have? Penicillin in there.
You also
I guess
some people
that's
have collodium, Imodium, and that's
Imodium,
how
collodium
in it,
in
so that if you
there.
are running, it can
Aha.
show.
Yeah. I don't know. I don't have a first aid box now. I don't know how many people have first aid boxes at home and the content in there. So let's start from the bleeding. Then we'll come to the box
too as
later.
well.
Yeah.
Okay.
So how do we manage the types of bleeding that you've mentioned? Should we have anyone have a cut, a bruise at home? How do you handle it so that I don't get infection or bleed more than necessary before you go into the clinic to get
so with the management, it looks a bit similar, but you know, with internal bleeding, I advise you go. That one you don't see. So how will you manage? So you go to the hospital. But let's look at this video on how to manage the wound at home. So imagine you've had a cut at home. How do you manage it?
Like a guy who had a cut while
chopping. Yes. So at the last part of the video, you could see that he was trying to do something. I mean, there's a cut. So why don't I wash it, you know, apply some pressure and that is it. Yes, that's also, I mean, management. But when you come to, let me explain it into details a bit. So if you find yourself bleeding, the first thing you need to do is to calm down. Because we nurses, I mean, health workers, you've seen blood, I mean, a couple of times. So for you, it's normal.
You'll be calm.
Yeah.
But for those
them,
who are not in the clinic, I've been in the clinic,
exactly.
so I'm okay. Yeah. But then for someone who hasn't been in the clinic to see blood,
yes, they are mostly
even just
anxious.
a drop can cause trauma.
Exactly. So you need to calm them down, else they won't allow you to do whatever you want to do on them. Even patient, if you don't reassure them, they won't give you the go ahead to treat them. Yes. So you need to calm down. Yes, you know, sometimes the laceration is so big that just an EM but just calm down. You get it. So it depending on the causes. If let's take for instance, you step on broken bottles. Sometimes there are particles on the wound. It is different when it's stuck or embedded in the wound. There are some particles, so mostly the advice is just wash it. Still you'll be bleeding, just wash it and apply pressure. I mean, that's the basic you can do at home. Just apply pressure on the wound, so that the bleeding will stop. There are some people who have underlying conditions like their platelet is low, and you know, platelets help with the clotting. So if it's too low, it wouldn't help, but at least you've done something. And imagine the bleeding is coming from the arteries. Look at how forceful the bleeding is coming. So you need extra force to, you know, to apply on that particular bleeding, then for it to stop. Then you elevate that part so that there will be backflow, because the body needs the blood. We can't allow it to go. So whilst you're applying pressure, you elevate your hand so that the blood that will come out will rather go in there so that the body will use. So basically it's the pressure that you need to apply. Then if you don't have these things at home, just go to the hospital. I've seen a couple of times where somebody will get him or herself cut or injured or something, and then they'll be applying spirit. We have what we use spirit
I told you
for.
we used to have spirit in our first aid box.
We have what we use spirits for. We don't apply spirit on fresh wounds. I mean, yeah,
it hurts. It really hurts.
So you see, you're damaging your skin. You're rather causing further damage. And some people use povidone iodine. We've stopped using that for a very long time. Some people use spirit on fresh wounds.
If you don't have spirit, we rush in for a perfume.
No. Look, wound heal by itself. We just close it so that the healing process will be fast. But if you get cuts, minor cuts, you can leave it. It will heal by itself. Just that we are trying to prevent infection, so we need to cover it up so that bacteria hovering around cannot enter and cause infection. That is why we advise you come. By the hospital, we have normal saline. It's just salt and water. And you know,
so we can prepare.
You can prepare your salt and water at home. If you can, go and buy normal saline. Keep it in your first aid. Go and buy dress solution or ointment. Keep it. Get a gauze. Keep it in your.
No spirit.
We have what we use spirit for. I'm not ready to show them what we use for spirit here. But at the hospital we use spirit, but not on open wounds and all that. No. We know what we use our spirit for. And hospital, we have a type of spirit. It's not just any spirit. Like you're saying, somebody can pick perfume and then on the spirits, no man a day can do anything. We all in and then I buy any nurses. But funny enough, it works.
Yes, so
it works.
So when you have spirit at home,
it works, but you know the damage, you know, and then the scar equates after that. So you just get these things, apply pressure. If it's a minor one, you get your ointment, your dress ointment, apply it. There are some people, they go to the hospital, they get this antibiotics creams, they apply it on it. You can keep it in your first aid. Take P more, be fine. Then if it is severe, you can go to the hospital, especially if the wound is deeper or is punctured wound. Now mind you, there's no way you should take out the next picture. Take out a punctured wound or embedded object in a wound. Try to take it out.
Okay,
so like this, you see there's a pencil. You see that we're not going to go to school. And the pencil now one. So you can see that the person might be bleeding. So what you can do is see how the person is applying the pressure. Just apply the pressure around it. Don't try to pull any embedded object in a wound. It's very dangerous. Okay, you can pull it out and then maybe it's stuck in an organ. You know, the doctor have their own way, they put it out and then they repair the organ or whatever part it is. But you pulling it out, from the hospital, do what and bleeding and blood is equally important. So with this, you don't do anything about this. Just apply pressure around it and then quickly.
Now, how do you apply pressure around it?
Yeah, that is why you're doing this.
Because if you're not careful, you think you are hurting the person more. So then the best way is let me pull it out.
No,
apply
don't try.
Pressure on it.
No, don't try. So it's just around it. You know, you just fafa one side when you know about the fat objects now.
Okay.
Then you hold it like the extremities.
Okay.
You hold so honey. Then you take the person to the hospital. So you are preventing the blood from coming. Some people try to tie the other ends with tourniquet or any, you know, how do you call it? Piece of cloth at the end. So they be holding mojan into new flow to that part. Then you take the person to the hospital.
Okay.
It's mostly the best. So you don't pull anything out. Obi will see one or two. No, don't do it. Just go to the hospital. They will have a way that they will do it for you, even feel the pain. They will take it out for you and then arrest the blood. For all you may know, your platelets is low. You get it? There are some people that naturally they bleed. One are not bleeding. How will you know? It's all good to at the time of the hospital. No more than in then you are dying gradually. So, these are the management.
No pulling out.
No, not at all. Just apply pressure on the bleeding. And then one thing, there are some people too at home that will pour salt. I mean, salt and water.
You said
that
salt
is
and
what
water,
we use. But why do you have to pour salt on the wound? And they are still bleeding, and then they will be watching them, the blood and the salt.
Soaking
oh my God. And then it will stop because your clotting factors are good. So you will quickly form up. God is wonderful. You know that. I mean, such a creative God. I mean, he knew that all these things will happen, and he actually put measures in place. So you are bleeding, and all of a sudden it will stop by itself. But we want to stop it fast. That is what we are saying. Apply pressure.
Sometimes we don't want to see the blood at all. So anything to stop the bleeding,
they will do it.
They will do it.
I mean, and don't go and pick just anything and then put it on it. Get a clean gauze towel, whatever. Put it on it once you apply the pressure. Apply the pressure. You need to apply it for like 10 to 15 minutes. Some people fear, depending on, we want it to be like, you inside, there's no blood coming. The cat will be there, but there should be no blood. So you need to have a firm pressure on it.
To apply that pressure in there. Okay. I think, let me check if there are any comments or questions on this first part. Then we can move on to. Okay, we don't have any questions yet, so I believe everything is sinking well with us. Yeah. Okay, so the next thing is to talk about seizures. But I want us to go for a quick break. Okay. Give ourselves a minute, and when we get back, we'll dive into seizures. So please don't go away. Stay with us. We'll be right back.
Because of man worry, didn't ma worry. You have put that altar down, and I pray for you. altars bi wo fie ha yɛse mani pandie altars bi wo fie ha ɛnema pada so ha altars bi wo fie ha ɛkasetia hyɛbrɛ ɛkasetia mpagya ha altar bi wo fie ha yɛse ma nware ɛma wo ba ha yɛnyɛ sika yɛnyiri nkyɛ 35 ɛwɔ sɛ nipa wu. I stand on this holy altar ha alipadaba the power that resurrected Christ from the dead. I stand on that power. Let that satanic altar be put down.
Amen.
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 Hey, welcome back. This is Health Talk on PCTV, and we've been discussing first aid at home, specifically looking at bleeding and then seizures. So we've had the first session on the bleeding, the types of bleeding, and how to manage it at home. Now we're going to talk about seizures, and in the studio with me is a professional nurse, Elizabeth Butchie, and she is helping us understand these topics. Okay, so Auntie Ness, as we always say, Auntie Ness, welcome back. So now we're going to look at seizures. So when we say seizure, what is a seizure? Tree, I think is it a chair or something? I forgot.
Yeah,
That's
sure.
it. Okay.
Yeah,
Okay.
sure.
So can you explain what that is?
Okay, so with seizure, I initially told you that, I mean, I like the combination,
Sure.
bleeding and then seizure. But okay, let me talk about the seizure. We'll get there. So when you talk about seizure, in the brain, I keep saying this, God is wonderful. You know, there are, you know, messages or electrical activities that goes on in the brain. They send messages to us to do something. So as I'm talking, there's signals are being sent in my brain. I'm telling you, that lazy talk, raise your hand, you know, do something. Yes. Yeah. But at a point in time, something will happen, and then the messages will, you know, the messages will be sent like abnormally. Let me put it that way. So the electrical impulses will just be sending messages. That's what this video. You understand? We have neurons in the brain that you know it does that kind of job. Yes.
They release electrical impulses. These impulses send messages that tell different parts of the body what to do.
Look at how the messages are being sent. See, it's very fast.
Yeah.
Very, very fast. And these are abnormal electrical signals. So these are abnormal electrical signals. And they have effects on the body. When it comes to the abnormal signals, the message needs to send it to, couple of times, the brain gets overwhelmed. And then you start feeling it on your body. So imagine the brain is telling me that dance.
When there's no music.
You see, no, the brain is telling me maybe there's music and I say sa.
Okay.
And I'm in pajamas. And then it gets to a point there's a problem in my brain. So it's telling me pajamas. Me pajamas, I was in pajamas. Like, what else do you want me to do? So you have effects on the body. You see that you'll be checking all the symptoms, you start feeling it. That is seizure. And there are a lot of things that, you know, causes that. It can be brain tumor. When a tumor is at a particular part of your brain. You know, the brain is divided in two hemispheres. We have lobes. They all have, you know, the parts they play on our body. For me, I know that the hospital part of the brain would see it, you know. I mean, it's help with the vision. So imagine there's a problem there. So the messages that are supposed to be, or the electrical impulses or activities that need to go on there is being impeded, or it's being affected. It means you have problems with your eyes, right, and then your face. Yes, exactly. So depending on where the seizure is, where the abnormal electrical impulses is occurring, sometimes it can affect the whole brain. It means that you see the effect on your whole body. Yes. So tumor can be a part. People who have strokes sometimes.
You do have seizures.
Yes, because I told you that I love the combination, because bleeding is here. Someone who is having stroke means that the person is not getting enough blood in the brain. So if you don't get enough blood in the brain, the brain needs how do you call it? Oxygen to function.
Well.
So imagine you are not getting enough blood to the brain. I mean, how is it going to function? You get it? So, yes. So people with stroke equally, end up a fall, trauma to the head, and all that. There are some people with diabetes cramp with that because more than sugar and dose we don't need it. So imagine you are going to eat and you are putting a lot of salt in it. Can you eat it? So I can't use a blood that is so concentrated with glucose. So yeah. So you see, there are lots, but I mean, because of time, let me just narrow it down. So that is what goes on in the brain. So basically, that is seizure.
Okay. So I'm sure definitely there will be different types, as you have mentioned that. So the entire brain affects different sections of the brain.
Yeah, a lot.
So what are the types, and how do we recognize these types of seizures? Like we did with the bleeding.
Yeah.
So now I know when I have a cut or a bruise, I know, okay, this is from a capillary.
Yeah.
This from the venous. This from the artery.
Yeah. Okay, that's good. That's good. I mean, learning has taken place.
Yeah.
Okay, so with the types, we have a lot, but there are few that we've noticed. Some we don't even know that this is a seizure. So we have the generalized one where I told you that when the whole brain is being affected,
Okay.
I mean, it have effect on our body. I mean, so this is a generalized seizure. So it's having effect on our body. So the person is going to where there's stiffness, there's checking. Sometimes. So these so the brain is not able to communicate to the body that do this, but rather causing the body to go through this. So this is a generalized, and that is what we mostly see around. We mostly see people falling and going through these episodes here. We have another type, partial. I didn't get let me just explain. We have another one that is partial, but the partial, we have a lot of partials, let me put it that way. But partial means that some parts of your brain has been affected, so it's not all. I saw a video some time ago where somebody was in class learning, and then one part of the body, there's this checking movement, and funny because on him say seizure. I mean, but at the end of the day, there's another part of the brain that is helping him to concentrate in whatever he's doing. So it's just some parts of it, and it's starting in 9 penna. So yes, we have another type that we call the absent seizure. It falls under the partial.
Okay.
Yes, the partial. Let's watch this.
Taken for daydreaming. One of the hallmarks of absence is that the seizures happen many times in a day. Sometimes they're so fleeting, they're easy to miss. This boy is having frequent but very brief episodes. You can see his eyes flutter up. He's out of touch.
See what I'm photographing now?
So sometimes you're talking to someone. Then you tap. I'm not saying that if you are talking. I'm not saying that if you are talking to someone. No. Sometimes people
have
are
things on their mind.
exactly. But people that are actually having neurological issues like these, you see that they'll be staring at the space or staring at you. So they have these staring issues for some time, few seconds, and then they will just come back to their normal senses.
Okay.
So it's a type of seizure. Do you ever know this? Well, you are aware of this. Exactly.
All I knew was the general one.
Exactly. But we have these ones. We have another one that is called drop attack. I say apple if you throw up a tough one. That's a old tongue. So look at this word.
Andy? Andy?
Yeah, this is what we call a drop attack. So just like that. Sometimes you'll be walking with somebody we want to tough him. No, I'm sorry. He just had a seizure. That's a pass here.
Faint. How do you differentiate fainting
That's what I'm
from
telling you. That's why I'm telling you that. At the end of the day, I'll give you a tip. I normally give this tip whenever I go out. It's kind of a slogan for me. You get it? You don't take chances. To say our tough you feel say attack be an arm for heart attack and that's or fainting or people don't just faint. Something happens in the body before. And remind you, the brain controls the body. So what the brain will tell you to do is what will happen. You get it? So if you bombard your brain too much, so you see the effect on the body. So imagine somebody thinking, you see the effect on the body. You get it?
Yeah.
And when you make the brain overwhelmed, the better one. So always need to have a positive mind. So this drop attack, there are a lot of them. Some people have just their leg shaking, some people have just their hand shaking, some people have just their head shaking. So all depend on how long it lasts. Some time ago I went to give a talk, the same seizure. That one cries epilepsy at a church. And somebody asked, so is seizure the same as epilepsy? In a point, yes, no. Because if you're having multiple seizures, then we can say you're epileptic.
Okay.
Yes. Because seizure is not supposed to last more than 1 to 3 or 1 to 5 minutes. You get it? If it lasts more than the brain you become overwhelmed and it will damage. Then you become vegetable. Yes. Because you're not getting any blood there. Whatever is there, it's having effect on the brain. The brain is not able to communicate to the body. So then what is my use? You get it? At a point in time, you ask yourself so many questions. My brain, let me just die off and then go. Hey, that is what the brain also go to. So imagine going through this electrical impulses. Why are they grabbing me at? I'm coming to a layman's perspective. Why are they we're going to me at? Then the brain will not work at all. So that's why we see that if you experience a seizure at home and it's more than 3 minutes, the person is not come to the hospital. We can do magical by the grace of God. We have medications that they can muscle relaxers that can relax the muscles, and then the seizure will go off, and then the brain can be reset. There are other diagnostic investigations that we do that will reset the brain, and then you have your normal activities.
Okay.
Get to see. So these are types of seizures. We have a lot, but today you know drop attack.
Yes, now
you know absence seizure. You know the partial. You know the generalized one, of course. Yeah. So these are a few types, but we have a lot. They are tonic. They are a lot, but I mean, some of them we don't really. Yes.
As I was watching the first video of the general one,
yeah.
I was just thinking, is it painful? Like, do they have pain?
Well, for them, they did at that moment. They don't feel any pain. They won't feel any pain until they are done.
So when they come back to themselves, when they gain consciousness out of that
Episode,
period,
yeah.
that episode, do they feel like pain anywhere?
Yes, a lot. Some get injured. So imagine you're going through this shameful disease, and then you end up. Some people wake up and you see bruises all over. So that's why I'm saying this combination is good. They'll get bruises, they'll be bleeding. So if you happen to be there, you need to solve that. Help them, because mind you, at the end of the seizure, some people go into in fact, all of them go into deep sleep, and then they'll be having incontinence. You need to help them. Okay. Imagine it happening behind your window. Let them come in. Be a good Samaritan. Let them change. Because of the jerky movement, they will end up, soiling themselves. So you need to help them. They get bruises. Some use their head to hit things and all. We'll get to management. I don't know whether it's bad, but we'll get to management.
We'll have to talk about the management. So in this case, like say it could result in injuries. How do you handle them in a way to protect them when they are having that episode? How do you handle them generally?
Okay, so in every seizure, some people, they know when it's about to happen. There are some triggers, or there are some things that will help you to know that I'm about to have seizure. Some don't know, but some do. So in seizure, we have stages before I get to the management. Okay. So that these are things that will equally help us. So that if you know that you've gotten to this stage, let me quickly go to the hospital, get medicine, so that it will not come at all. Get it? So in the stages, you can have we call it prodromal stage, or the pre-seizure, where it happens like days before seizure will happen. Yes, there are some people for 1 week, not done a so TPA. Maybe I know number. So today, if you are watching me, you should know, say, if you have this seizure issue, now we say 3 days to a basin, and now would see your I mean, just know that this is it, that is it. You see them, they're having, yes, you see them having, they are not unable to sleep, they are anxious. So the prodromal stage, that's what happened. Then you come to the oral stage. The oral stage, that is where we see that's the warning sign. You see all the warning signs there. And there's a word there that I like. I won't say I love, for the way I like. It's called the deja vu feeling. Deja vu feeling. So you see that you're having a feeling that like something that has happened already is about to happen.
Yeah.
So you're feeling that sometime ago me touch it, yeah, it looks like it's about to happen. It's a warning sign. Just after that, na seizure walk. You get it. So I was watching a video, and then it was a live video on seizures, and then people were commenting. There was a woman who said that anytime my daughter will come and see that, mommy, I'm anxious, mommy, I'm this, our big blanket or the saffron, I want a hole. Make sure that all the chairs are away. And not the toys and goose now in Diago. So you'll be monitoring. So that is where the child get the seizure. Yeah, there. Like, oh. So these are warning signs. You get it. Some at the oral stage you'll be having, you know, weird taste, weird smell. You get it. So it's about to happen. So just, you know, to help yourself, maybe you cannot get to the hospital quickly, and then you just, it will happen, but make sure it happens at a safer place. So that brings us to, so the next stage is the seizure has happened. The other stage is that after that, what should we do to them? We need to help them. So that brings us to the question you asked. So how do we manage them? Yeah. Seizure can happen at any place. At the hospital, when it happens, you won't last more than 2 minutes. We have what we can do for it to stop here. But imagine you're in a car and somebody is having a seizure in a car, or you work at a mechanic shop, or in the middle of the road, it happens.
It does. I not to cut in, but I once saw that I was in a moving car, and then on the side of the road, when our car got there, there was someone lying on the floor, and you could tell the person was having a seizure. Yeah. And cars just went by,
and there's this one funny thing I heard. It's so sad, but please, seizure is not contagious. They will tell you, man, Sonny, let's be each other's keeper. So imagine it happens in the middle of the road, and then the cars are just passing. Maybe fun and so in seizure management, we are looking at how to prevent injuries, because whatever the person is going through, it's an embarrassing, you know, condition. So it's either you remove the patient from the danger, or the person from the danger, or you remove dangers around them. So you do more fitter. Let's try to take them off. How will you know say we be or your piano? You get it? Okay, thank you. Maybe we cannot pull out the car, but let's bring the person and put the person in a place that or done no kwa bibia and no. Imagine it happens in the middle of a road. Cars are passing. Be a good bystander. As Ghanaians as we are, I mean, you get a lot of bystanders, but engage them. Let them stop the cars. Move the patient away. I saw one, the person nearly entered the car. The way I shouted at the bystander, but just so I mean, you get it. And don't try to restrict them. Just allow them to go through whatever they have to go through, but we need to protect them from further injury. There are some that are going to their offices, they have their tight clothing, and they help them just release. Let them release them a bit so that they will have free, episodes. You get it? Then after that, don't try to restrict them. Some people try to put things in their mouth, trying to put their legs. No, we don't need that. So just allow them to go through. When they go through, like I said, some show themselves and all that. It's embarrassing to wake up and see a lot of people around you watching you going through this. I mean, come on. So if you are the lead at that point of where the episode is going on, try and control the bystanders. As Ghanaians as we are,
we love to just stand by and watch. And the bad thing happening is
want to watch
videoing.
It's not good. Imagine it is you. So we shouldn't. If you are not helping them at that point, please go your way.
Go your way.
Don't, even if you know the person, don't let the person wake up and then see that you've seen him or her. It's not nice. So go, whatever you are doing, just continue doing it. And then one thing that is very difficult is that you see them. They get up and then they'll be working with it. Meanwhile, there are people around. Help them out. Help them to clean, change. I mean, sometimes they go into deep sleep. It's not nice. Yours might not be seizure. There'll be other things. So as you are preventing them from injury, the bigger picture for them is the embarrassment. They're any day not one way but embarrassment. So help them clean and then take them to the hospital. Ebi wa on fa na edu. Ebi wa asa. Ebi wa Felisa of far their side effects on far, so it will okay. Need to help them, be a good Samaritan, take them to the hospital.
Okay.
So this is what happened to them because it would definitely occur again and can lead to epilepsy. We don't want it to happen because high fever in kids can lead to convulsion. Convulsion is actually a characteristic of the seizure, the movement. So this is what we can do. The hospital, we can just give you injection, muscles, relaxes that relax you. But outside we have to help them. Nobody will help them. So that's the management. What we can do to help them.
Wow. That's very true. Show some love, offer help.
Very cool.
Yeah, and as much as possible, if you can push many bystanders away, tell them it's okay. If they're not ready to help,
go.
Just go your way.
What are you doing? Yeah.
We need to take care of each other. You don't necessarily have to know the person to offer help.
No, not at all.
You don't need to do that. Okay. We have some comments here. Let me read that. So from Solomon Jason Ashikwe says, "Good job, Elizabeth Butchie. Always proud of you." From your manager Jason. Thank you for joining us and thank you for your kind words. There's more. So it says, "This is just the beginning of your greatness. God grant you wisdom and understanding in your daily field of work. Big ups and a lot of hugs, my superstar." Again from your #1 fan. Yay! Thank you so much, Mr. Solomon. Thank you. Really appreciate your kind words and for joining us on the show. And to everyone else who's been with us from the beginning. Today on Health Talk we have Nurse Liz, as I call her. You can say Auntie Ness, like we always do in the clinic, Auntie Ness. And she's delved into the topic of first aid in the home, bleeding and then seizures, which we just did. All to say, we just have 4 minutes to go. I don't see any questions in the comment section.
That's nice.
So I believe it's sunk well. We've learned well, and I hope we'll put it into good practice. When you have cats at home that results in bleeding, now you know the various types of it and know how to manage it before you go into the clinic. I think with the capillary and the venous ones, you can manage it at home. But then with the you need to
run.
You need to rush to the hospital.
Venous too, sometimes you need to run depending on the cuts. It can be deep cuts. You can't stay at home with deep cuts.
With deep cuts, you can't stay at home.
You need to go to the hospital.
And if you know you are the type that
your
this condition,
platelet is slow,
you don't clot quickly to allow the wound heal. Please, first aid, quickly wash off if should there be any particles in there to prevent infections, and then a clean towel, or gauze. If you don't have a gauze, you can get a clean towel, put it on the cut, apply pressure, and then rush to the clinic. Don't turn yourself into Auntie Ness. Auntie Ness is there waiting for you in the clinic. She's in the hospital waiting for you, so rush there and have her attend to you with the right medications, and they will show you how to handle yourself when you get back home as well. And then with the seizures, we're showing love. Should they happen to anyone you find on the streets, we're talking about the home, but if it's on the streets, then you can offer help in moving the person away from danger, moving objects away till they have their episode, and don't have too many people around them. It's so embarrassing. Please, if you can't offer help, go your way, and probably the best you can do is say a word of prayer for the person. Yeah. If you can't do that, please move away quietly. Don't just stay there or taking videos or what. That doesn't help. Okay, let's show love in doing that. Thank you so much, Auntie Ness. Auntie Ness, thank you so much for joining us on the show today.
Thank you for having me. I'm always glad to be here.
This knowledge and insight into this topic. I think we need to do there's another part we have to do, so I'll definitely pull her back and then we'll touch on another aspect of the first aid at home. Thank you. I don't know. I'm so grateful
Thank you for
on
having
behalf of our mother, Apostle Mrs. Ajima Prempe, and then the entire membership and our lovely viewers who have been joining us and always join us. We say thank you for being here and sharing this knowledge with us, and we'll be good students to
I
apply
pray
the
so.
knowledge to apply all the knowledge that we've learned here today.
Okay.
So, any last words?
So I
advice?
mostly say this after my presentation. You don't take chances,
Okay.
and then remember that your health is in your own hands.
Mm-hmm.
So could you now room and send there or but your health is in your hands.
Exactly.
You need to take good care of your hands because the hands does a lot of things. I mean, see me in chambers and I'll give you the explanation. But your health is in your own hands, yeah. So you need to take good care of yourself.
Please take good care of yourself. We need you alive and healthy.
Yes.
Alive and healthy. So take good care of yourself. And hopefully we'll be here back again next week on Health Talk on PCTV. And it will be another interesting and exciting time here on the show. And before I go, let me acknowledge my sponsors because they've been so helpful and supportive in not just our program but all other programs on Health Talk and also to the ministry. So in no particular order, I first like to acknowledge our partners. They are the main and proud sponsors of Your Salvation Is Now Crusade, and this ministry has brought blessing to many, saving souls from perishing, and it's open to all. So to be part of this ministry under the Promised Land Faith Ministries, that's our partners, you can call us on 0243804676, and voila, you'll be part of this ministry. Then we have Ben Travel Consult. They handle anything regarding to travel, your documents, how to put your documents together, visa applications, and their passports. Today I don't want to talk much about it. Please, if you don't have a passport, call them or visit them at Osuforiko Mall for assistance and also get your passport to travel. Then we have Lightest Media supporting us with all our media needs. And so if you have any media issues, whether you want a program or an event photographed for you, videography, if you want flyers, you want to brand items, you name them, they are there to sort you out. So you can call them on the numbers showing on your screens and they will attend to you. We also have Hemco Enterprise. They sponsor us with drinking water. So they are located at Makomti 2 and also at Dowenya. And you can call Hima on the numbers showing on your screen and she will deliver to your doorstep. Then we have Rope Automations. They are into roofing and block making machines. They have construction and batch plants. So whether it's installation, servicing, modifications, you name them, they are the right people for you. They are located at Ajin Kotoku, Amasaman, and you can also call them and discuss whatever needs that you have and they'll be ready to address them for you. Is it general clearing of goods that you need, exports, imports, freight management, or door-to-door services? Prissy Logistics is there to handle them for you. She is located at Tema Community 2 behind the Hunch Catering Services. You can call her, her numbers are on the screen, and she will attend to you. Then, opposite Tema Stadium, we have Kenley Company. They are into the buying and selling of new or used furniture. So if you have any of these that you want to sell, you can call them, or you want any to buy, any furniture to buy, they will be there to help you. Then we have Reps Household Limited. So they deal in gadgets. Whether you have cash or you want it on credit, call them and then discuss the terms and conditions, and then you will have the gadgets that you need in your home. Then we have Decovas Enterprise. They are into all kinds of decor for any event at all. Even if it's an office event that you want done, it's not just the weddings, the engagements. Yes, we do all that. She does all that. and she does for corporate institutions as well. So you call her. She is located at Tema Committee 2, adjacent the Tema Committee 2 post office, and her numbers are there. You can call her and she will be there to attend to you. Last but not the least, we have E-Fashions and Boutique. They are at Tema Committee 1. Opposite they also adjacent the Committee 1 police station, and they deal in unisex attire for both adults and kids. So if you need any attire for any festive occasion, anything at all, attire, call them and they will get it for you. Classic for you. Okay, so that's it for our sponsors. Once again, thank you so much for joining us on the show. It's been wonderful having you and wonderful having our Auntie Ness in the studio with us today. Next week we are back here. We'll confirm the topic we'll be discussing in our posts on the page, and you can join us and also invite others to join us on the show. Okay, I thought I had a question here to mention that before I go. So this is a comment from Henry Asefua. It says, Madam Dr. Elizabeth, thanks for the good and educative message. Thank you, Henry, for joining us. It was good I didn't miss your comment. Yeah, and not to miss, one of our sponsors is Crash Makeovers. I hope I got that right. Crash Makeovers, yes, they are also part of our sponsors. So if you need them, their numbers are also on the screen. Your beauty needs, just contact them and they'll be ready to sort you out. So also soon, it's time to say bye. Have a very good Sunday evening. Stay healthy. As Auntie Ness said, your health is in your hands, the power is in your hands. Take good care of yourself. And we'll see you same time next week, 4 p.m. with another discussion. My name is Abigail Kwe and I've been your host. See you. Bye-bye.
Everything you do in this world,
then should be done in the name of the Lord Jesus.
Hear me. And I was sorry. Adia ukoye bia na nyame ni animu kan baby akom nyame ni animu kan wudi nyame bedi onim kan wonye na wokoka. Hear me and hear me good. Na me ni nkofo bi kodi nkomo. That day I pray for supernatural wisdom. Say what me kase be pie free manum di manim kan tia me ne me nka ne ma me nka me hia wanim adom wo me kase mu ma me kasa nkyere sampa me odi nwurufo. Ema mia me nka me kasa me hia wo kasa etimi duru ane wasem me awurade wo ma me kan na ma me hu me ma me nka de ye me ma dwena me de ka na mo me kasa mu no ne wo be kasa me nka no ena ma me nka. What in everything you do, if you want to escape from the snare of the enemy, make sure say in everything you will do, everything you will say, what should be done in the name of Jesus, as you give thanks through him to God the Father. Don't say use. Adibe na me peminsan kanti bebreni nyame ayaka. The Christopher bebreni nyame ayaka. Because I have waited for too long. Enti me ni pedua wa sorry them. Na so me honhon ne me kra ne madwene ne makoma de eniha. But me ni pedua nesia. But ne ma honhom, ma wo kra, ma wadwene, ene wakoma ensambra wo nyankopon nchen bio. From today, may God help us. Amen. To do everything in his name.
Amen.
To say everything in his name.
Amen.
Every day bia enyame adom e de rade asema me enyame aye bio nde bia wote enema ene practice on it, learn. Oh enyame adom nyame adom bia e boko enyame na ayo e rade de menhia e wote nyame woni kasem Uti nyame on adie yi nyina mu. Everything na ko practice on it. Nyame atom. Eye Awurade na ye. De Awurade asema me. Nyame ti ase. Nyame aye bi. Nyame be practice on it.
Remember, the greatest wealth is your health. Thank you for watching.